Kirsten Gallagher. I'm the Cancer Support Program Director at Smith Center. And yesterday I celebrated my 8th year anniversary. So I've been, I know, right? I've been doing this work for a while for Smith Center, and I love it because I get to meet people like you and people like Dr. Kelly Bethel. Yeah, she's right up there on the left on mine. So today we have the good fortune of learning about a yoga therapy program at the Maryland University of Integrative Health. And like I said, I'm very fortunate because I get to meet people like this. But what's really cool is people reach out to Smith Center and want to engage with us and support our community. And the Maryland University of Integrative Health contacted me and said, we have this offering, and told me all about it. And I thought, this is so in line with Smith Center and our participants. And I hope that you will love learning what you hear and that you will take advantage of the program. I think as a yoga teacher myself, I know firsthand that yoga has been hugely instrumental in my own health and wellness, in all the people I've taught in the 8 years I've been at Smith Center for cancer survivorship. And I really just thank you, Kelly, for being here with us. And I'll let you tell them a little bit more about who you are. And one more housekeeping thing actually is, if you want to ask questions, you can use the chat function, and we will try to get to as many questions as we can. And anything else. I think that's it. So welcome everybody, and welcome Kelly. Thank you so much.
Thanks, Kirsten. I'm thrilled to be here. I'm, as Kirsten said, I'm Dr. Kelly Bethel. I have a doctorate degree in physical therapy. I've been in clinical practice for 29 years now. And I am also a certified yoga therapist. And I've really been working in integrative medicine since about 2007. I am the yoga therapy manager at Maryland University of Integrative Health. I've come to this, I'm new in this position. I started in January. I was the clinical director at the Center for Integrative Medicine at the University of Maryland Medical School, and now have transitioned more into teaching. So I'm faculty and managing the student clinic, which I'm going to talk to you a little bit about tonight. But I really wanted to start first with just kind of, because I know we have people from all different walks, and we have some people who are like the navigators or the social workers, and then we have clients. So I want to just kind of bring us all on the same page. I know you guys have a very robust program at the Smith Center, so I want to just talk about yoga in general, and then I'm going to talk about what yoga therapy is and what some of the research is. You know, we've had this big influx of research in the last couple of years to really show the benefit of yoga for cancer. So I want to kind of present where we are, because if you look at the graph, it's really been in the last like 3-4 years that we have now all these studies that are really showing it. And we actually have enough studies now to start developing clinical practice guidelines. So I'm very involved in the Society for Integrative Oncology. And we are now at the point where we're going to start creating clinical practice guidelines for yoga and yoga therapy in the cancer. And we're going to start with breast cancer. So it's going to take us a little bit of time, but it's exciting to know that we finally have enough research to show what we all know from working in this field to back up. And so I'm going to give you where we are, because we actually have recommendations now, which is really encouraging. So that's kind of where we're going. Once I share my screen though, I can't see the chat. So Kirsten's going to monitor the chat. So I promise we'll have questions. I'll save plenty of time for questions and answers. Kirsten has my email. You guys can email me anytime. And I'm happy to answer your questions, if something comes up afterwards. Let me share my screen. I'm going to go fancy schmancy today. It'll be a blob. If I can find it. Here we go. Let me see. I think I can't find it. I say I'm going to be fancy schmancy, and then I can't find my PowerPoint here. Oh, never mind. We're going to skip the fancy schmancy and just go with the regular. It's easier that way. Okay. So a little bit about what yoga is. So the word yoga means to yoke together or union. And really what the goal of yoga is to alleviate suffering. So the practice of yoga is working towards the goal of alleviation in suffering. And in yoga, what we are doing is we're really exploring the causes of suffering and its alleviation. And again, this is yoga in general. We're just going to talk about yoga in general right now. We'll get to cancer specific in time. It's one of India's oldest and most extensive traditions. It goes back centuries. And if you were treated in an Eastern culture, yoga has actually been used as a medical, you would be given a prescription for yoga. You would be given asanas or breath practices or mindfulness in the Eastern culture. So Western yoga and Eastern yoga vary differently. And so, in Eastern culture, it's actually it's a practice that's used medicinally. And then a typical fashion, we bring it across the oceans, and the world has, completely changed it. And now everyone thinks yoga is a physical workout practice, and really it's not. And I know from my experience in working at University of Maryland in the cancer programs there, the first thing they say is, I don't want my clients standing on their head. I don't want my clients doing back bends. And I was like, no, we're not going there. So really, unfortunately, in the Western culture, we've made it a workout. And that's not really what yoga was meant to be used for. I mean, it can be, but really it's got so many great benefits beyond fitness. So as you all know that have practiced yoga and are taking the yoga classes at Smith Center, it's not just asana. It's not meant to be a workout. And really it includes the practice of pranayama, which is a breath practice, asana, which is movement, meditation or mindfulness, and lifestyle practices. Those are really the 4 pillars. No one really knows, and science would love to say, oh, it's the breath or it's the asana that makes yoga work. We really don't know. It's a combination thereof. And also because it's individualized, especially in yoga therapy. So what works for one person may not work for the other. And so it's very hard to pinpoint that it's that specific breath practice or that specific pose. We have, as I said, a ton of research now on the benefits of yoga. So in terms of the pranayama practice, that's the breath practices. We know that it relaxes and cultivates resiliency in the nervous system. We know that a breath practice can activate the nervous system. We know that it can activate the parasympathetic or the relaxation response in the nervous system. So for people who are in a stressful situation, that those breath practices that really activate that parasympathetic system are really powerful. I have clients that use just something as simple as a breath practice all the time. The physical poses and the breath practices help to maintain normal alignment in the spine and chest wall. They can be used to strengthen the muscles in the lungs, including the diaphragm. Your diaphragm is a muscle, and you have muscles between your ribs. So those are important. Breath practices also, when we work with students that using breath practices, we can help them identify inefficient breath practices. So inefficient breath patterns. Where I've seen this a lot in cancer is especially post-mastectomy. Often my clients, because it hurt, may only breathe into the upper parts of the throat. And so learning how to re-engage those muscles and have a more efficient breath practice actually helps with fatigue and energy and all of that. So, we have tools that we can use to really help create and correct some inefficient breath practices. And then we know when we use breath practices therapeutically, it helps with decreasing stress and tension. And again, like I said, activating that parasympathetic nervous system and creating that relaxation response. We know from research that asana improves balance, strength, flexibility, stability. We can explore patterns of letting go of fear of movement. If you've had surgery or you have had injury or something to a particular part of the body, it hurts to move. So sometimes we stop moving it. And so, learning how to, when you're cleared for safe movement, learning really how to move in a way that is therapeutically letting go of those patterns, noticing like, oh, I hold my shoulder here like this every time I move, becomes a pattern of working to move without elevating the shoulder or without cheating and using different muscles. We learn to, in yoga asana, we really work with our clients to challenge their beliefs. Really, and again, I say this because I work a lot. Not only do I work in cancer, but I also work in stroke and brain injury. So learning to really love and honor their body where it is that day becomes really important because often my clients feel like their body has betrayed them. So how do we meet our body where it is and learn to honor where it is that day and really honor and nourish what it needs? Yoga allows us to know the difference between pain, stretch, stiffness, and overdoing it. We learn what movements and range of motion are correct for our body. So even if you've never had any type of chronic illness, any type of movement, there's certain movements that, based on the way you were created, that may or may not work for your body. And that's okay. That's just part of how we were designed. And then learning the difference between stability and mobility. Mindfulness practices or meditation, and I will say I use mindfulness and meditation interchangeably. They do have a slightly different definition, but in my work, I always use them interchangeably. I've worked a lot with vets, and that meditation can have a negative connotation. So they've seen mindfulness has become more my common word. But we know, and we have so much research on mindfulness and meditation, that we know it relaxes the nervous system. We know that it improves concentration. We know that mindfulness practice can help with emotional regulation. We know that it can, increase the attention. We know that it can help with decreasing rumination over negative thoughts. And those are things like imagery, mantra, just concentration, and yoga nidra all would fall into those type of meditation or mindfulness practices. And then we have the philosophy. These are the yogic texts that we often pull into our yoga classes. So you'll hear, especially in the Western culture, about the sutras and the yamas and niyamas. And these are really moral and ethical principles, such as non-harming, contentment and truth. And we've had studies around applying these yogic texts in yoga classes, because sometimes students, yoga teachers aren't always sure how to pull them in a way that is, like not harming. So I always give the example, if, if I'm working with someone that has back pain and they need surgery, and they're smokers, we know that there's an 80% chance that they'll have failure of their surgery if they continue to smoke. So if you're still smoking, but you need the back surgery, like that comes into that non-harming. So having discussions around that. But we know when we pull in these practices and talk about this philosophy, that it actually was decreased cortisol, so which is a response to stress. So when we looked at a group of college students, the yoga was more effective when those philosophies were pulled in versus when they were not pulled into a yoga class. And then self-regulation. Yoga, especially therapeutic yoga, is individualized. In yoga therapy, we assess everyone. So it's a very customized session. And in yoga therapy especially, but even in a regular yoga class, the participant is really in charge of themselves, and the yoga practitioner is the guide. And really what yoga does, it allows the student or the client to learn to self-regulate. And we know when you're in charge of what's going on and you can self-regulate, that we have decreased stress, we have improved health and well-being. And we've seen this across neurodegenerative conditions, chronic pain conditions, and PTSD, that being able to, take charge, and if your blood pressure is high, using a breath practice that may help calm it down really helps to decrease stress and allows you to be in charge. And then we also know with resiliency that because we're decreasing the autonomic nervous system stress response, that's that fight, flight, freeze mechanism, that we can create mindfulness and awareness, that it can be combined with breath and a physical practice. And again, we're improving resiliency during stressful times. Any questions there before I go into yoga therapy? Because I know that was a lot. That was like the down and dirty yoga.
There are not any questions in the chat, but if anyone wants to unmute and ask a question, you're welcome to do that at this moment too. All right.
All right. So I want to talk about yoga therapy in particular. And I want to be really clear, because you guys have such a good yoga program that I don't want in any way apply that the yoga program that Kirsten's running in yoga therapy, one's better than the other. They're different. And so when you look at this graphic, and this was from an article that was in 2019, yoga therapy rests in yoga. So they're not separate. One's not greater than the other. They're a different approach of using yoga. So yoga therapy, the definition really is the professional application of principles and practices of yoga to promote health and well-being. And really that's in a therapeutic relationship. So it can be one-on-one, it can be group. I do run groups, especially in my stroke and brain injury work. That includes, but one of the biggest things is that yoga therapy includes a personalized assessment. So we look at you in that biopsychosocial spiritual framework, and I'm going to talk about that in a minute. We write treatment plans, so there's goal setting, We talk about what you want to manage in your lifestyle. And then we develop a yoga practice around that. And it could be simple as breath practices. It could be breath practice, mindfulness, journaling. It could be a huge, it could be really what you as the client want to work on. And again, it can be delivered in individual or small groups. It really just depends on you, and also, what's available in your community. So in yoga therapy, we're looking at the yoga tradition. So in yoga, we use a Koshik model, which is very similar to the biopsychosocial spiritual model. And I'm going to talk about that in a minute. And as I said before, like regular yoga, or like yoga's the overview of yoga, we're really including the breath, the mind, the body, and how they interact with each other. And again, we're looking at, having a positive influence and allowing you, the client, to create a toolbox that helps you with your needs and your desires and your goals. So typically our goals in yoga therapy may include eliminating or reducing or managing symptoms that cause suffering. So in the cancer continuum, we have used yoga therapy for sleep. We have used it for anxiety, depression. I've used it working in the chemotherapy bay when asana isn't available, but having a yoga nidra where you can get rest while you're receiving chemo. We have done things, created programs for, short segments of mindfulness practices that can be used while people are getting radiation. Certainly in survivorship, we've done the whole gamut. So it really can be applied really anywhere across the cancer journey. And really it's about living well, whether that's living well with a chronic condition and living well without a chronic condition. It's like, what does living well mean to you? What does having a life full of meaning and purpose mean to you? And how do we help you get there? And again, yoga therapists draw from the principles and practices that we know. And then, again, like I said, one of the foundational differences is the assessment of the client, and then developing an individualized treatment plan. So when we look at a yoga class versus yoga therapy, let's first look at the yoga therapy client. So typically when someone comes to yoga therapy, they're looking for help or relief from a symptom or a condition. So maybe it's pain. I get a lot of clients, because I have a background as a physical therapist, that want to work on balance, want to strengthen. I have some friends who have a mental health background, so they may seek them out to have something to work on their anxiety. It could just be overall wellness. And then we again evaluate, and we use yogic techniques to help that client feel better, improve their function, improve, whatever their goals are. The yoga therapist really is focusing on that individual person's needs and goals. And we really are trying to understand why their client has come to see them, assess them, develop a treatment plan and an intervention. And when you look at the class versus therapy sessions, again, we can do work in groups. That's not what we're going to offer. We're going to offer individual sessions. But again, we are looking at an intake and assessment, and we're working on very specific symptoms or areas that that client wants to address. And our role really is to empower the clients to be more active in their self-care. So instead of me, and I always say this is kind of the difference in PT, if you came to see me as a PT, I may give you an exercise and I'm applying the treatment to you. In yoga therapy, we're gonna work together to come up with a practice that works for you. And it's your role to enact the practice. It's my role just to guide you, but I'm not prescribing per se. We do work with the biopsychosocial spiritual model. And so what that looks like, and like I said, in yoga, it's called a Koshik model. It's a little different, but the same idea. We know really in healthcare, we know really in healing and really in being well, that relationships are extremely important. We know that you as a client being able to identify when you're not breathing correctly, when you're having a feeling of anxiety, that self-awareness is a really good tool. And it's also a therapeutic tool, because once you identify what is that feeling I'm feeling in my body, then you have some tools in your toolbox to address that. We also want to look at the client's history in context of their life circumstances, right? So having, support, having meaning and purpose, if you are no longer able to work or care for your grandkids and that was your job, and that gave you so much joy. How do we recreate that? Or how do we find you a new way to create joy and passion in your life? We'll decide what aspects within the yoga model are important for your treatment. And really what it is it's a multi-dimensional treatment, looking at the whole person and really looking from a wellness perspective. The training for yoga therapists are very different than a 200-hour. Most programs, you start with a 200-hour yoga teacher training program because you have to understand what the different poses and the different breath practices do and how to teach them. The standard certification, though, is an additional 800 hours on top of that training. And then I would also say in cancer, we know we're going to have not only where we're moving towards is not only the additional 1,000 hours of training, which is what a CIYT would have, but then also looking at additional cancer-specific training moving forward is kind of where we're going because it's such a specialty niche in yoga therapy. Looking at what the clinical trials, and because now we know that yoga is so beneficial, and we do have some problems in the yoga literature because there is a difference between yoga class and yoga therapy, but in the literature, they just call it yoga. And so we're in the middle of looking at a scoping review, looking at what is yoga therapy versus, do they apply yoga therapy? Like, was there an assessment? Did they create a treatment plan? Are they really conscious of, what they're doing, or did they just write a protocol? So we do have some problems in the literature right now. But you can see when we start looking at yoga for cancer and clinical trials, and these slides were from Dr. Cohen at MD Anderson. He was gracious enough to share them with me. He presented at the Society of Integrative Oncology a couple months ago. And so these are his slides, and he gave me full permission. So I just wanted to cite my source on that one. But you can see how we're really starting to get robust research. And that as we've moved into the late 2017s and, even now into 2021, we have more trials over time, and we really are at a place where we can start writing some clinical practice guidelines. We know that the National Comprehensive Cancer Network, for anticipatory nausea and vomiting, yoga is recommended if it's approved by a physician. We also know that yoga is a cancer recommendation for breast cancer fatigue. And then considering yoga to improve areas of survivorship, such as distress, cognitive function, menopause symptoms, and pain, the National Cancer Network is also looking at. The other problem too is that they sometimes pull out meditation or breath practices or relaxation, even though it falls under yoga. So they'll say relaxation practices, which really falls under yoga too. So, it's, again, we have some problems with the research, but we know that, we now know we have enough integrative tools to really have some teeth behind what we already know anecdotally. When we look at the integrative oncology guidelines, and they looked at all integrative medicine. So you'll see a little bit more, you'll see a couple other modalities on here, but I wanted to include them on this. That music therapy, meditation, stress management, and yoga are recommended for anxiety and stress reduction. Meditation, relaxation, yoga, massage, music therapy are recommended for depression and mood disorders. Meditation and yoga are recommended to improve quality of life. And I cannot underscore how important it is for quality of life, meaning and purpose and joy. We know that when you have meaning and purpose and joy in your life, your longevity is longer, regardless of any underlying medical condition. And then acupuncture, and I included acupuncture and acupressure on here for chemotherapy-induced nausea and vomiting, because the NCC, which is the Natural Care Center at MUIH, also has acupuncture. It's not virtual, it's in person. But I wanted you all to know that, I love yoga, but there's some other integrated practices too that we have some real research around. So I'm always a big proponent of acupuncture. Anything on those before I just talk about MUIH and questions?
Looks like we're good to go.
All right, go ahead.
Go ahead.
Was there a question?
Maybe we were just talking over each other. I think we're good.
Okay. So MUIH, or Maryland University of Integrative Health, or more affectionately known as MUIH, is one of the nation's largest, most progressively accredited universities, completely dedicated to integrative health. We are value-driven, relationship-centered, and healing presence is really critical. Like, we think that's having healing presence with our clients is really critical to the client's success. And again, we're using that wellness model, that idea that we're not applying, we're not taking a disease and saying that, oh, you need X, Y, and Z. We're really looking at you as a whole person. And we're really bridging science and ancient wisdom. We're an evidence-informed practice. That is why the research for me is extremely important. We have to know that what we're doing has works, and that there's real evidence behind the effectiveness of it. We started in 1974 as a small acupuncture clinic, and today we have over 18 academic programs, 1,300 graduates, 170 faculty. We have alumni all over the world. And our natural care center does over 50,000 treatments and consultations annually. We have continued to see clients, whether it's virtually, the yoga therapy program is still virtual, but like I said, acupuncture is currently seeing clients in the clinic. There's a nutrition program, herbalism, and health coaching as well. So a little bit about the yoga therapy clinic. The students are in training as a certified yoga therapist for 2 years. Their senior year is the clinic portion, and they meet once a month for 3 trimesters. All sessions currently are virtual, and we will continue to have a virtual component in the fall. And the virtual sessions are free. We are currently offering the Smith Center clients, if they wish to partake in individual yoga therapy sessions. We're scheduling right now for June and July. And if you're interested in having a free yoga therapy session with our students in the clinic, you just need to email me. And as I mentioned, there's other modalities in the NCC. So if you're looking for an acupuncturist, or you're interested in acupuncture or health coaching or nutrition, you can check the website, and that lists the modalities. You can also call them. Health coaching, I know, is not running this summer, but I'm not sure when they will be back up and running. But I do know those visits are virtual. Nutrition and acupuncture at this point are in person. So MUIH might be too far to go, but and I'm not sure who's charging what for what programs. But the yoga therapy sessions are free. You just need to email me, and we will be off in August and back in the fall. So if this doesn't fit in your schedule right now, we certainly can see you come fall. That's all I got.
Thank you. Thank you. Does anyone have any other? Oh, Kate, do you have a question?
I do. I just have one question. I know someone who is recovering from cancer but lives outside of the area. I wondered if she might be able to participate in this if she's interested.
Absolutely. That's the beauty of being virtual. That's why, that's in this meeting today. That's what I said. I'm like, we can't go back. Like, we're able to reach people all over, all over the place. So right now we're seeing clients virtually anywhere from, we're literally seeing clients from Hawaii to Maryland right now virtually. So yeah, perfectly fine.
Okay, thank you. Fantastic.
And non-cancer clients too, we'll take them. Like I said, I know we're focused on cancer, but if you have someone that you think would really benefit from yoga therapy, feel free to send them our way.
I have one more question. Do you recommend people who want to partake in the program kind of coming with a goal in mind, like I would like to work on my anxiety, or I'd like to work on my side effects from my chemotherapy? Or during that assessment, is the person that's working with you going to kind of pull out what's most beneficial for that practice?
I would say both. I mean, if you don't have any in mind, like you just really like you love yoga and you just really like the idea of having a one-on-one session, that's a perfectly good reason to come to yoga therapy. Like, that's great. It doesn't have to be, it can just be like, I really get a lot out of yoga, and you might not be able to know that it's the relaxation response or whatever. It may, but then I also have clients, like I said, who come to me because the fatigue or the nausea or, the scan anxiety is a big one that or being on, radiation anxiety, like being on the table during radiation treatment, that's a really specific like goal. Like I need something when I'm on that table that I can tap into really quickly. So it varies depending on the need. And then again, cancer is a continuum. So what your need is when you're in treatment, or what your need is this week in treatment and 4 weeks down the road, may totally change. And when you move into survivorship, it could be totally different as well. So it's not an all or none, like this was your goal, can't change it. Really, in cancer, it's a continuum. So we can change the goals over time.
Terrific. Terrific. Well, thank you so much for reaching out, for extending this awesome offering to our community. It's really a true gift, and we appreciate it.